now that Dr. Eileen has conducted significant research on HIV and other STD. He had been with CDC for 18 years, and he worked with TUC in Bangkok, that the office there, for 2 years. And Dr. Eileen Lee led the development of STD treatment guideline on HPV and genital warts in 2006, 2010, and 2014. Please, Dr. Eileen Dunne.
Thank you very much. Sawadika. Thank you. It's a real pleasure to be here today.
The microphone.
Sure. Do you want me to turn this on? It's a real pleasure. It's a real pleasure to be here today to discuss with you something that many of you know very well, I understand, which is research. I'd like to talk to you a little bit about research development and also make the case for why research is so important in public health. So I would appreciate questions and dialogue along the way. I am welcome to have any questions that you might have about my presentation or related to my presentation. We'll begin. There we go. So I wanted to add a few bullet points why I think research is important for public health. I think research is important because it helps prioritize the public health agenda, what's important and what's not, with a local context. Sometimes there can be research from the United States that doesn't apply to other settings, or vice versa. So the idea of doing research in local context with local considerations is very important. It can inform policy and practice, so the things that we do in public health. And it can also support adoption of important prevention interventions. It can provide baseline data, descriptive data to support these interventions. It can evaluate novel or new interventions. Research can help evaluate existing interventions and their impact. What's new. You may have some other ideas of why you think research is important or your own research has been important. But I'm really lucky because today we just had published, you in Thailand just had published a very important milestone, which is elimination of mother-to-child transmission of HIV. This is a landmark. I'm going to send this paper around. This is really important, and you can kind of look at it, but I can send it by email as well. I want to highlight this especially because it's an example of how research and results of research can then lead to program and result in huge impact, which is elimination of a disease. So, as you can see here, the example of prevention of mother-to-child transmission, MTCT means mother-to-child transmission, HIV in Thailand, really began with research activities. As maybe some of you remember, here in Thailand there was a research study of short course AZT to evaluate efficacy and prevention of mother-to-child HIV transmission. This study demonstrated 50% reduction in transmission, which was very important to galvanize the program activities. Then as a result of knowing these things and the burden of mother-to-child transmission, there was implementation of pilot activities from 1997 to 1999. There's a monitoring system activity. Then there were policies that resulted. In 2000, the Ministry of Public Health announced the first national prevention of mother-to-child transmission policy and guidelines for all pregnant women. ART, antiretroviral therapy for prevention, infant formula for infants born to HIV-positive mothers. And policy then led to practice, which is training of providers and health officials, implementation of guidelines, tracking of disease, and continued monitoring for the effect of these policies on disease. And here we are today announcing elimination of mother-to-child transmission in Thailand, June 2016. Thailand is the first country in Asia to validate the elimination of mother-to-child HIV and syphilis transmission. This is a landmark. So I wanted to highlight a few things that I think people don't talk about but are needed for research. Research requires vetting. Well, what is vetting? Vetting is dialogue and discussion and critique and continued changing of activities to address issues as they arise. So vetting is a process. Vetting is openness in discussion about research activities, getting the best input possible. Time, I think we all know what time is, but research actually requires considerable time. If you use the example of mother-to-child transmission, just look at the time frame for that from research to elimination. It takes much time to do the research, but then the impact takes time too. Resources. Research often does require special resources for the activities and commitment of staff and partners. And then last but not least, it requires partnerships. Partnerships with the community, partnerships between groups that are interested in the research activity, either new development of partnerships or supporting existing partnerships. So I wanted to just highlight a few things that aren't talked about so much about research, but I think are really important. Oh, sorry. Let's go forward here. So I wanted to ask you, as experienced persons in research, what do you believe research begins with? What does it start with? I have one idea of what it starts with, but I'm wondering what others think it begins with.
So, in your idea that what is the first step that we start to conduct the research? Even in Thai, you can speak Thai. เราเริ่ม research เนี่ย start ที่ไหน This is the kind of wetting.
Yeah, vetting.
Vetting
Exactly.
is
Where we have
talking.
discussion.
Question, talking.
I see you have. I think you have a comment. I can tell.
May I start my opinion? I think that when we would like to start the research, at the first step, we should make a research question. And I think that research question will come from the problem or the question from the practitioner in that field or in our field.
Yeah.
That is my
Very, very good. And that's what I think too. I think research begins always with a question. So you answered the question, which is a question. And then how does research move forward? I think you have to lay out also objectives, hypothesis, and methods. Now, objectives are the to with the action, to investigate, to evaluate, to describe, to quantify. So the objectives will break down the research question. A hypothesis is important to guide the methods. What do you think will happen in the research based on your best available knowledge and methods? So I'm going to actually lay out, this is a conceptual relationship between research problem, objectives, and research questions and hypothesis. And this was pulled from a book that I have on research in public health, and I think it nicely describes how research develops. Research problem. What is the epidemiology of HIV and STIs in men who have sex with men in Bangkok? objectives to assess HIV and STI prevalence and incidence in a cohort of young MSM ages 15 to 29. The questions or hypotheses are socioeconomic factors associated with HIV and STI acquisition. And my hypothesis is yes, that lower socioeconomic status is associated with HIV along with other social determinants of health. Let me explain. Socioeconomic factors are factors such as poverty. And poverty and other factors are associated with disease.
Which part that could you break down the research problem that I'll maybe discuss later. But which part of the component or the small step under research problem that we can focus on, and which part that you think is the most difficult of this process?
Yeah, so I'd like to hear from you what of these, yeah.
ใน research process เนี่ยส่วนไหนเนี่ยที่คิดว่ายากสุดแล้วก็ไอ้ research problem เนี่ยมันยังมีขั้นตอนย่อยมันอะไรได้บ้างเนี่ยอยากอาจารย์อยากจะลองถามพวกเราบ้างตอบเป็นภาษาไทยก็ได้ครับหรือภาษาอังกฤษก็ได้เสรีก็ได้ส่วนที่ผมพยายามแชร์หรือพยายามดึงว่าอาจารย์จะถามอาจารย์ก็ถามพวกเราเฮ้ยคิดว่ายังไงนะรีเสิร์ชรอบเล่นเนี่ยมันกว้างมากมันเป็นบล็อกใหญ่มันมีอะไรขั้นตอนย่อยในนั้นไหมอะไรอย่างนี้นะครับแล้วก็อันไหนคือส่วนที่ยากสุดของมันดังนั้นผมให้คิดนิดนึงก็ได้ว่ากว่าจะได้คำว่า what is the epidemiology of HIV เนี่ยมันมาจากไหนไปเอามาจากไหนทำไมถึงได้คำถามนี้มา so what's the idea that you have come up with the question of what is the epidemiology of HIV in MS and in Bangkok? This is very critical question that specific the populations MSN and why this question was asked ทำไมถึงได้ถามคำถามนี้
I think that this question is come from the problem in the practice to identify the size or the burden of the disease. That is the question. The size of the burden of the problem of public health problem.
Yeah, so one question, would be what is the burden of disease in this population? Exactly.
ผมว่าถ้าในประสบการณ์ที่จะทำงานวิจัยก็จะเห็นสอดคล้องอาจารย์ก็คือหมายถึงว่าในสภาพการทำงานเนี่ยเราพบว่ามันมีปัญหาอะไรหรือว่ามันเริ่มเห็นอะไรที่ผิดปกติอย่างเงี้ยมันก็ถ้าสมมติว่าเราคิดว่ามันยังไม่มีองค์ความรู้ตรงนั้นเนี่ยอันนี้ก็เป็นมันก็จะเป็น research question ขึ้นมาเนี่ย
He agree with him that because of our his daily activity that to take care of the HIV patients and maybe he sees some abnormality in this group and he would like to quantify that what is the burden of that particular group.
Very good. I think a lot of research questions occur from clinicians in routine practice. They've noticed all their patients seem to have a weird rash, or they notice some attribute of the population of their patients, and they ask the question and follow through with the research. So I think it's being astute meaning looking for differences or issues in your population. And finally, last but not least, is data collection and methods, which does also take a lot of time and energy and is important to make sure that your questions are being addressed. If my question is about socioeconomic factors, that is things like poverty, I should have elements of poverty indexes in my instruments, in my questionnaire. I should have questions about that, or I can't address the question. So all of these items feed back on themselves, and then you have to make sure your instrument and your lab collections are able to address the question as well.
So the arrow between that box
They kind of should go back.
should be
yeah.
should be, you have to very certain that the arrow have connected. Sometimes it's not connected at all. Sometimes the data collection is not connected with the research problems. That's my experience.
I agree.
Yeah.
I agree. And I think sometimes actually what we probably should do is add an arrow that goes back to the research problem for all of these things, is making sure that connection occurs to all of those elements. I completely agree.
Do you mind if I
No, please.
read it?
Yes.
อาจารย์บอกว่าบางทีเนี่ยช่วง data collection เนี่ยบางทีทำไปเนี่ยมันหมุนกลับไปตรง research problem อีกว่า data collection อ่ะมันไม่ work หรือมันไม่มีกลับไปหาเป็น research question เหมือนที่พวกไอ้โปรแกรมที่ทำแต่วันจันทร์นี้นะคือพอตั้ง research question มาหาไป data collection ไม่มีก็ไปสืบว่าแล้ว data มันคืออะไรก็กลับไปใหม่หมุนย้อนส่วนผมก็เก็บมาจากที่อาจารย์รามาสอนเมื่อนักเรียนเมื่ออาทิตย์ก่อนว่าพวกเนี้ยมันไม่ connect กันมันไม่ต่อกันเช่น research question กับเนี่ยไปคนละทางซึ่งเจอบ่อยมากเวลาผมเป็น paper ของนักเรียนของพวกกรมนะ objective กับ research question ส่วนมากตรงแต่พอไอ้ question ไอ้ตัวมานั่ง data collection methodology ไม่ตอบ objective หรือตอบเกินก็มี sometimes is the methodology or data collection is over than the objective. Sometimes it's not connected. Sometimes it's not related to that objective. That is the problem that I have seen.
Yes.
A lot of that issues in our research in our Ministry of Public Health.
Yeah, I think it's really important that objectives cover what you want to know, because if they don't, people will question, well, why are you asking this question? Why are you asking that question? Why do you collect this lab data when it doesn't have relevance to the objectives? So I think it is really important.
But from your example, it's correct because of that research question and objective is get along with each other very well, and also the hypothesis is come from that objective, and the data collection is correct, not correct. That's proper to get the answer, get the answer from those questions. For example, focus group guys. Because of for MSM you cannot get the data collection by questionnaire, but you have to do some kind of qualitative instrument. In the public health we have that focus group. คือผมบอกว่าอีกตัวของอาจารย์ตัวอย่างมันตรงเพราะว่าแต่ละช่องมันล้อกันหมดแล้วก็เลือกไอ้ data collection ก็ตรงเพราะว่า MSA มาอยู่ไปให้มันตอบแบบสอบถามจ้างให้ก็ไม่ได้ความจริงหรอกต้องไปทำโฟกัสกรุ๊ปอะไรแบบนั้นหรือถ้าจะเจาะเลือดหรืออะไรก็ว่ากันไปเจาะเลือดของจริง so focus group is some kind of qualitative
Yes, yeah. So focus groups are where a population, usually 6 to 10 people, are brought together into a room to interview using a guide, open interviews to get more information that's not necessarily so yes, no. It's more contextualized for a population or an environment. Sometimes it precedes collecting data in an instrument in a quantitative fashion. It's very valuable though qualitative work is incredibly important. And focus groups and interviews are two examples of qualitative data collection.
จากการที่มาโฟกัสรูปที่คนประมาณ7 คนแล้วก็มีท็อปปิกอาจจะเป็นไกด์ไว้แล้วก็ถามแล้วเสร็จแล้วก็ค่อยมาเลือกคำตอบดูว่ามันอินเทอร์วิวว่าอะไรอินเทอร์วิวก็อย่างที่เคยเรียนมาว่าบางทีอินเทอร์วิวก็ต้องมีการเรียกว่ามีคำถามไกด์ไลน์แต่ว่าคำถามเปิดแล้วเสร็จแล้วค่อยมาโค้ดในการนะครับ
So I actually wanted to bring up some real concrete research questions, just as an example, and walk through how maybe I might think about addressing them with hypotheses. But some questions that might come up, let's say in the Ministry of Public Health, might be about flu vaccine. Does flu vaccine work to prevent infection and disease in my community? Does this injectable drug work to prevent HIV in men who have sex with men? Or is this screening test for Zika virus rapid and valid? Rapid meaning it occurs quickly and we get the results quickly, and valid means it's correct, or as correct as you can allow. So I put in some examples of what a hypothesis might be. My hypothesis is vaccine effectiveness is equivalent to clinical trials of efficacy, but I think there's reduced effectiveness in older adults. So that might be the hypothesis I'm working with for my research question. For the second one, does this injectable drug work? My hypothesis is there is efficacy equivalent to existing and effective biomedical prevention strategies. So for example, the existing pre-exposure prophylaxis, there might be a question about better or equivalent intervention approaches. The final question is the screening test rapid and valid would be, I think the screening test has a high sensitivity and specificity and positive predictive value measures of a test, and it's available in 30 minutes.
So it's nice to explain that hypothesis should be in the paraphrase of that question.
Yes.
ผมถามว่าสรุปแล้วไอ้ไฮโพธีซิสเนี่ยคือการปรับคำพูดเป็นอีกภาษาหนึ่งใช่ไหมก็คือพอถามว่าวัคซีนนี่มันเวิร์กในอะไรนี้หรือเปล่านะดังนั้นเนี่ยถ้าเกิดจะกลับคำถามให้เป็นไฮโพธีซิสก็คือไฮโพธีซิสเนี่ยคือวัคซีนนี้เท่ากับอะไร equivalent to นะว่า testing reduce แต่สงสัยมันจะไม่ค่อยได้ผลในผู้ใหญ่ซะละมั้งพอไฮโพธีซิสเนี่ยอันนี้ผมเดาเองนะไม่แน่ใจมันไม่พูดนะสงสัยอีกหน่อยไฮโพธีซิสเนี่ยมันจะกลายเป็นตัวนั้น research question แล้วก็เอาสแตทมาเทสเชื้อตามที่เราเรียนมาอันนี้สไลด์ให้ดูเหมือนอาจารย์จะยกตัวอย่างว่าพอเราตั้ง research question ได้ก็จะกลายเป็น hypothesis so hypothesis should come directly from the question
Yeah, yes, and I think hypotheses are very important because when you do research, you're not doing what we call a fishing expedition or going fishing for results, but rather you're honing in on what you believe to be true to test whether that is or is not true. Does that make sense? Yeah.
คือจะตั้งคำถามลอยๆก็ตั้งนะแต่พอจะไปทำวิจัยเนี่ยมันเหมือนตกปลาก็ต้องตกในตรงที่มันมีเหยื่อตรงที่มันมีปลาเพราะงั้นต้องตั้งไฮโพธีซิสด้วยว่ามันน่าจะอย่างนี้นะไม่ใช่ว่าเลื่อยเปื่อยว่าอาจารย์นั้นไอ้ฮูดดิ้งคือได้ชื่อก็ฟังรู้เรื่องนะแต่ว่ามีฟิชชิ่งนะ fishing you cannot you cannot fishing all over the pond but you have to any some idea that where in the pond or in that place where is the fish
That's right.
and then you make the hypothesis and you test the hypothesis right
This is correct. Yeah.
ถูกแปลถูก
Yeah. And I want to, actually with this slide, I want to talk about the concept of efficacy and effectiveness. So efficacy, and this is, I think these words are very similar in Thai, but they're very important differences. If efficacy is what you find in a clinical trial of an intervention, how well it works to reduce disease. Effectiveness is how well that intervention works in the community in a real world setting, so in the real use. And sometimes what's found in a clinical trial in a research study is not the same as what would be found in a real world setting. Where there's complicated implementation issues, it might be harder to remember to take the medicine. There might be a number of issues that make it harder to implement, even if the efficacy is very good.
Okay.
Yeah.
So the correct pronunciation efficacy
Efficacy.
efficacy
Yes. Versus
Which I-
effectiveness.
efficacy.
Yeah, efficacy.
efficacy
Efficacy.
efficacy
Yeah.
and effectiveness
Effectiveness.
effectiveness and efficacy
Different terms.
different
meaning.
different meaning อีแรกเนี่ย efficacy นี่คือภาษาไทยว่าอะไรว่าไปนะท่านไม่รู้แปลว่าประสิทธิ์
ประสิทธิ์
ประสิทธิ์อะไรก็ไม่รู้นะ
effective เนี่ยเดี๋ยวประสิทธิ์มีผลละ
แต่เราทั้งสองประสิทธิ์ฟังไม่รู้เรื่องแต่ efficacy คืออย่างนี้ คือว่ามันใช้ได้ผลหรือเปล่าในสถานการณ์ที่ไปเทสมาในสถานการณ์ห้องทดลองต่อ effective นั่นเนี่ย in the real world
Yes.
effectiveness for example ตัวอย่างเช่นยาเนี่ยมันได้ผลแน่ๆถ้าเราเทสแต่เอาไปให้คนไข้กินที่บ้าน if they take the medication home sometimes the patients forgot sometimes in the community that intervention not work in the real world but for example for our context for the dengue hemorrhagic fever
Yeah.
they have the measure called IVM they say this is very effective actually it's not effective because of they have that efficacy in some ideal communities but when they give the implementation in that northeastern of Thailand it's not work so the efficacy of IVM is good but the effectiveness is not good is that right
Yeah, I mean, that is validity. So that's about validity of the test. And validity, obviously, in a controlled setting, in the special trial, you can find results that are different than in a real world setting, for sure. Maybe the tools to do that test aren't available in the lab. Maybe it takes more time. So there are really important differences between what is seen in the study and then what is done in implementation. That's why pilot studies and implementation studies are so important to
อาจารย์
look
ก็เลยบอกว่า
at. Yeah.
ไทรอยด์สตัดดี้เลยสำคัญแต่ที่เน้นๆก็คือว่าคำเทอมสำคัญคือ control situations for efficacy they have control situation you have control you control everything and you get efficacy but in the real world in the communities in the real world it's not exactly the same in the real world we need if it's work we call effectiveness in the real world so sometimes it's the same sometimes it's not the same
Very
Right.
good.
Yeah.
Yes, exactly.